Welcome to GW Integrative Medicine, the podcast about disease prevention and health promotion from the Office of Integrative Medicine and Health at the George Washington University School of Medicine and Health Sciences.
I'm Dr. Lee Frame, Director of the Integrative Medicine Programs here at GW.
And I'm Janet Rodriguez, the office's Administrative Director. Today, we're talking about sleep deprivation and glymphatics with Vivek Jain, MD, Associate Professor of Medicine in the Division of Pulmonary, Critical Care, and Sleep Medicine here at GW, and the Director of the GW Center for Sleep Disorders.
Dr. Jain is a graduate from the All India Institute of Medical Sciences in New Delhi, India. He did his residency in internal medicine and fellowship in pulmonology and critical care medicine at the University of Missouri Hospital and Clinics in Columbia, Missouri.
Dr. Jain's research on various aspects of sleep disorders have been published in more than dozens of peer-reviewed scholarly journals and numerous books. He lectures nationally and internationally on the topics of obstructive sleep apnea and heart disease.
Welcome to GW Integrative Medicine, Vivek, or welcome back.
Oh, thank you, Will. Thank you, Leigh, and thank you, Janet, for having me back.
Absolutely. We are very glad to have you back. Sleep's such an important topic. And I think this topic is going to be extra interesting because I don't think most people are going to even know what it is. So maybe we'll start there. What is the glymphatic system and how is it changing sleep medicine?
So, glymphatics is something that was recently discovered. So that's why there's not much known about it. We think about lymphatics, which I guess most of the audience will be familiar with, which is kind of a drainage system all over a body that helps remove waste, whether it be infectious stuff, inflammatory stuff, cancer cells. And so we hear about lymph nodes getting big. We've never really understood that there's a similar system in the brain that will allow removal of waste products. And it was in 2012 that researchers discovered this process happening inside the brain. So glymphatic is a take on the lymphatic system, but the GL or the gly part comes from the glial cells that are involved in helping remove this waste product. So what essentially happens in a brain, which is constantly active, is that the metabolism of each nerve cell produces waste products, byproducts that, if not removed in a timely manner, they'll start accumulating. And so, which makes sense, except that it hadn't been discovered. These glial cells, which are specialized neuronal cells, pump this waste material that accumulates in the cells after metabolic activity into the CSF, or the cerebrospinal fluid, and flush it out, so to say, out of the system across the blood-brain barrier. So it is important. And how is it changing sleep medicine? I think it helps. We've known for years that various forms of sleep disorders, and specifically, sleep deprivation or insufficient sleep, can cause various, disorders or health effects. One being, memory issues. So we know that sleep's important for memory, and when one is sleep deprived, it does affect memory, and so one can extrapolate that into the long term and say perhaps insufficient sleep can lead to, say, dementia, or be a risk factor for dementia in the future. And so one of the waste products that accumulates as a result of the normal day-to-day activity in all our brain cells is a protein called the beta amyloid, and so it's one of the many proteins, along with something else called the tau proteins, that needs to be removed from the brain cells and not be allowed to stay there. And so normal sleep, good amount of sleep, helps us do that. But if we don't flush it out and it accumulates in the body, then it causes these depositions in the brain cells, which we know from other studies done in dementia. One of the causes, or one of the pathological biomarkers, so to say, of dementia or cognitive problems is the accumulation of things like the beta amyloid proteins and tau proteins inside the brain cells. So it's like an extension. So if I sleep well, I don't allow those bad proteins to accumulate in the brain cells. But if I don't sleep well and they accumulate, that could be one of the reasons for development of dementia in the future.
That is so important. And I think we've talked in our previous episode about how people often don't prioritize sleep. And I hope that the glymphatic system will be maybe a real motivating factor for people to prioritize sleep, because we're not in a good position to be able to prevent or treat many of these cognitive disorders at this time. And if you could simply get more higher quality sleep to prevent it, that's something we can do.
That is so true. Because once these proteins start accumulating, you're right. There is no turning back. There is no, one of the, I guess problems with dementia treatment is we know that it's due to, in most cases, due to the accumulation of these bad players, the proteins. But we don't know how to get rid of those proteins once they've accumulated in a very large amount.
Mm-hmm.
And so you're right that it is almost like prevention is better than because we don't have a cure.
Right, absolutely.
Sleep and the brain, these two areas of study are just endlessly fascinating. So how do glymphatics relate to sleep deprivation?
Yes. So what is what is kind of understood after we discovered the lymphatic system was that what pumps this, and it's like a pump, right? So all these just like a blood vessel, so something inside the brain is going to have this pump action to remove this waste material. And so if one studies the physiology of sleep, so during deep sleep, the cells in the brain fired in a very synchronized manner, and so when they're firing in this synchronized manner, they create a force which is thought to create these the propulsion waves that then allows that waste material to move through the intracellular fluid in the brain and into something called the cerebrospinal fluid across the blood-brain barrier. And so that is the key, that this pumping action is required. And so is, and people have also felt that the supine position, of course, most humans don't sleep standing up. We do sometimes sleep sitting up, but that supine position also facilitates this pumping action and the movement of this fluid, removing the bad proteins.
So just a quick clarification for those in our audience that are not familiar with the supine position. What does that mean?
Sleeping on the back, or sleeping in the flat position. You can be sleeping on the sides, you can be on the back, you can be prone, like sleeping on your stomach. But the idea is that you're not upright, you're horizontal.
That makes sense. The way it's not trying to force it in some sort of direction against the flow of gravity.
Right. I mean, that might be the simplest explanation, but yeah, that could be. You're right. Absolutely. Yeah.
So obviously, glymphatics is really important for the brain. Sleep is really important for the brain. So how does all of this come together, and how does sleep deprivation affect mood?
Yeah, excellent question. Certainly, again, people have only recently started realizing the connection between good sleep and other mental and also physical health issues. Many years ago and very early on, almost 40, 50 years ago, one of the antidepressants that was used is to make the patient sleep deprived. So believe it or not, if somebody has, like a bipolar disorder or a manic depressive disorder, and the treatment, if they come into the clinic with like severe depression, the treatment offered was don't let that person sleep, and they will shift that spectrum from being depressed to being manic. Now, now a lot of people who have bipolar disorder or major depression or major, like manic depressive disorder are not usually bipolar. They could just be unipolar depressed. In that situation, obviously, the connection between sleep and treatment of depression is not that clear. In fact, the opposite is true, that if one is sleep deprived, it can actually lead to symptoms like fatigue and irritability, things that can be misdiagnosed as depression or exacerbation of depression. So it's almost like if I don't have the tendency to become manic, then and I'm just depressed, or even other mood disorders, including things like anxiety or schizophrenia, they tend to get worse with sleep deprivation. So we know that relationship is more in the direction of sleep deprivation causing worsening of the mood issues, rather than sleep depression being used as a treatment for sleep deprivation being used as a treatment for depression and causing manic episodes.
Hmm. Hmm. So, what else do we need to know about sleep deprivation and its consequences on health?
So, for the audience, I think, we've talked obviously about the connection between sleep deprivation and future risk for dementia. Uh, there are other aspects, so the independent effects of sleep deprivation on even things like weight gain and obesity. So, there were lots of studies were done, especially in Belgium and also from the University of Chicago, that very specifically looked at the relationship between what happens when a community and an individual is sleep deprived, and they very clearly found that even both at the individual level and at the community level, if one is not getting enough amount of sleep, they're more likely to gain weight, or also more likely to find it harder to lose weight. So if somebody comes to say to the weight loss clinic and is having a hard time following a good diet, doing some exercise, but not getting enough sleep, they will find it harder to lose weight. The same group of researchers many years ago also found the relationship between sleep deprivation and development of diabetes or insulin resistance. And that was fascinating to us because, in their initial experimental paradigm, what they found was that even you take a healthy sleeper, somebody who, says that they sleep 8 hours or more, and follow regular schedules. They have no problems staying awake during the daytime. They're healthy, normal sleepers. And then you collect these individuals, both men and women, and you say, you know what, I'm going to divide you into two groups. And one group, I'm going to make you sleep only 4 hours a night for 5 nights. And the other group can continue sleeping just like they normally sleep. And even after 5 nights of sleep deprivation, what we call as an acute to sleep deprivation experimental model, these 100% of these individuals who were in that sleep deprivation group compared to the people who were allowed to sleep normally developed signs of insulin resistance, and what we call as diabetes, within 5 nights of sleep deprivation. And then, of course, they were recovered and allowed to sleep more for 5 nights following this sleep deprivation. And fortunately, obviously, they all recovered. But this was the first idea that, my God, sleep deprivation that we all know we all are guilty of from time to time
Hmm.
can have acute effects, not just chronic effects. In a general population, acute sleep deprivation is rare. Somebody's on call, somebody's a police officer, somebody's a firefighter, somebody's on duty for
Shift,
36
a shift
hours,
worker.
shift workers. But
Hmm.
most of us get what we call as an opportunity to recover sleep, as I say. Like one night I'm sleep deprived. Obviously, we know we are sleepy the following day, and we recover sleep. Most of us can. Now, what is the other interesting finding amongst, after doing research, is that there is this more common condition called chronic partial sleep deprivation, in which we never, ever, ever recover from a sleep debt. So, what is a sleep debt? So, if say, most people to say requires 7 to 8 hours of sleep, and just for the audience, I think one way of looking at understanding how much sleep one needs is in a very simplistic way to say, if I'm on vacation and I get X amount of sleep, I feel good. What is that X amount of sleep? Because most of us during our day to day lives are a very fatigued and sleepy society because we're not really, we have many things that we think are causing a fatigue and sleepiness. But vacation is the right time to understand what my own specific individual sleep needs are. So if I meet those sleep needs on a regular basis, which for most individuals is 7 to 8 hours per night, uh, I'll be healthy for most part. Now, if I, for whatever reason, got say 6 hours of sleep tonight, that means 1 or say 1.5 hours less than what I needed tonight for whatever reason, then the recovery models have shown that I have to recover that deficit within the next 2 nights. So if I have a 2 hour sleep deficit tonight for whatever reason, I should sleep maybe 9 hours on the 2 following nights, or 10 hours and 8 hours on the 2 subsequent nights to recover from that sleep debt right away. What
So we
most
can't store it all up for the weekend, is what you're telling us?
absolutely that we cannot, we cannot. And that's what most of us do, is that we store it out for the weekend, that we sleep extra on the weekends to make up, but that model doesn't work. And that's why the more real life situation is chronic partial sleep deprivation. So there's this so-called the tale of two epidemics, where we've known that over the past 20 years as a society we have, or even over 30 years as a society, we've become more sleep deprived, chronically sleep deprived, not just acutely, and we are becoming bigger, and all these chronic disease states are flaring up, including metabolic disorders, diabetes, heart disease, and all of these now have been individually linked to sleep deprivation in one way or the other. Cancer is another thing which has now been linked to chronic partial sleep deprivation. Uh, there's a very interesting group of researchers looking at the immune system and sleep deprivation. And so we all talk about how autoimmune diseases, lupus, rheumatological diseases are starting to increase, and the question really is, why is that? Is it just maybe environmental, or maybe intrinsic to our body physiology? And so some group of researchers are showing the connection between inflammation and sleep deprivation. Also, a very simple example, and which we all should be aware of. For example, I go get a flu shot, right? And for whatever reason, after getting the flu shot, I do not sleep well that night because I have work to do or something to catch up with, and I get less than my requisite amount of sleep. Research has clearly shown that my immune response to that flu shot and generating antibodies is going to be much, much less if I do not get good sleep after getting a vaccination.
That really puts it in perspective. There's so many important things that you need sleep for, not the least of which is disease prevention, but that's in my mind, that's health promotion, right? We're trying to allow the body to educate its own immune system, so if it is exposed to a disease, it will not succumb to it.
Right. Right. And so, sleep is like our fifth vital sign in a way, we need it.
I love that. So, obviously, there's a lot of different health outcomes, negative health outcomes from sleep deprivation. What role, if any, does glymphatics play in that? Or do we not know yet?
We do not know yet. The only big players where we do know for sure is the development of dementia in a sleep deprived individual. So that's, both animal experiments and some human studies are showing the clear relationship between accumulation of these beta amyloid proteins, tau proteins, and risk for cognitive dysfunction. And obviously, you can extrapolate that to dementia. In sleep deprived individuals. It's very difficult to do retrospective studies if somebody's already developed dementia or cognitive dysfunction. How far back do we go in life and say, how much sleep were you getting 30 years ago when you were 15 years old? Yeah.
Right.
Yeah.
Ooh, that would be the best study if we could follow people, get all information about sleep, diet, all their exposures, have the sort of ultimate study. We could possibly figure out some of these more complex diseases like dementia that we really haven't done very well with studying.
I think one place where this is going to probably become easier to do if privacy rules and laws can be regulated, and just my personal opinion. So to the audience, I don't want you to go out there and say, "Oh my God, what is Dr. Jain talking about?" But with all these smart watches and all these
Yes.
wearables, we are collecting so much data on patients' habits. And if you can remove the identifiers from each individual data point and just collect that information and saying, hey, so young kids are wearing wearables, adults are wearing wearables, same individual is wearing a wearable, all this data is available for years and years and years, potentially now and into the future. If one can just say, I want my data from my wearable to become a part of a medical record, it'll be a great study.
Yeah.
I had a simple, one of the wearables recently. Patients bring this to us nowadays, and there's no way to make it a part of the medical record. It's just sad.
Yet. There's no way yet.
No way yet. Correct.
Let's keep our fingers crossed, everybody. So, how do you increase glymphatic flow?
Get more sleep. Short answer. Seriously. Yeah, and sleep
Plain
in
and
the supine
simple.
position. Don't have your. Again, most people sleep. Like flat. Or semi elevated with the head up, but that's okay.
Hmm.
Yeah, it's the sleep. Again, going back to experiments done by association between sleep and memory. It's not just the type of sleep like REM versus non-REM. Just sleep itself has been shown to have a very positive effect on recall and memory. Uh, and so one doesn't have to really say, oh, I don't have deep sleep or REM sleep. I don't dream. Maybe I don't get enough good sleep. Not true. Just any sleep.
So, give us your top 3 or 4 sleep hygiene tips for patients and also for clinicians to share with their patients.
You know, uh, be cognizant of the need for sleep. Consider it to be an important, as Lay pointed out, a preventive health measure, not just diet and exercise, but emphasize just the need for sleep. Uh,
Hmm.
and a simple questionnaire like how much sleep do you get during the weekdays? How much sleep do you get on the weekends? Are your routines constant? Are they variable? Because it's not just the amount of sleep, but that amount of sleep according to a certain fixed or a semi-fixed schedule is more important. There's some concept called social jet lag, where again most of us are guilty of this in the modern society, where we sleep from a certain time to a certain time during the weekdays and a different time to a different time on the weekends, and every hour difference between the weekdays and the weekends has an independent effect on health, cardiovascular health, independent of the amount of sleep. So sleep
Hmm.
tips would be get adequate amounts of sleep according to a more or less fixed schedule. Uh, Three would be, if you do end up losing sleep for whatever reason one night, then make up for that sleep within the next 2 nights and don't wait till the weekend. Other effects of like for example, noisy environment, lighted environments on lymphatic
Hmm.
flow is uh, obviously a hot area of research. Like if I read in bed and then take 8 hours of sleep, is my lymphatic flow the same as if I was sleeping in a darker environment? uh, that is unknown at present, but it kind of makes sense to most of us that our sleep quality is not as good if we've exposed ourselves to light in bed, like electronics or Kindles and
Hmm.
iPads. Uh,
And how about eating at night?
Eating at night within 2 hours of bedtime is not again a good idea for most of us, because it does disturb sleep, because food sits in the stomach and doesn't get emptied out into the intestines. So cool, quiet, dark bedroom environment. Not going from the computer to the bedroom. Maybe just relaxing, giving some winding down time before bedtime. 7 to 8 hours of sleep for most of us. According to a fixed schedule. Again, alcohol disrupts sleep, nicotine disrupts sleep, caffeine close to bedtime disrupts sleep in most people. So all these things would be good sleep habits, and it will is definitely improve lymphatic flow and theoretically prevent dementia in the future.
And what's your opinion on having a TV in the bedroom?
Again, if it's used as a uh, as a relaxing agent or a distracting agent, it's a different story. Most of us don't use it for that reason. In fact, we get stimulated by that light and the noise and the content that we watch.
Hmm.
Very few people I've come across, at least in the clinic, will say, "Oh, I use it as a source of white noise." And it's not true. Most of us are actually catching up on, because we've never had a chance to catch up, and so laying down in bed and catching up on the news and catching up on programs that we've missed or recorded on the DVR. So we are not relaxed watching that TV, most of us. So it's definitely not a good thing to have.
Well, that is good to know. And I know we aren't all always perfect, but it seems like most of these things are small little tweaks that we can make to improve. And like you're saying, even if you don't get a great night's sleep one night, well, then you have the next 2 nights to make up for it. So those next 2 nights, you really have to prioritize not watching the TV in bed, giving yourself the time to wind down, avoiding alcohol and caffeine, those type of things.
Exactly, and just start with one low hanging fruit, and then develop that into a good habit, and then start developing a second habit, which becomes part of the nature, and then that's how we get to the end of the journey.
Love it. So, what do you see coming down the pipeline in terms of research? What are you excited about hearing about in the future?
I think again, the question about what improves glymphatic flow. I mean, are there going to be medications out there in the future?
Hmm.
Is it going to be a substitute for sleep? So we know that sleep causes glymphatic flow and therefore removal of all the bad proteins and the bad players. And so if somebody says, you know what, I don't have the opportunity to sleep, but I don't want to develop dementia in the future, so what choice do I have here? Is that going to be something really powerful? Obviously, people, I don't want the audience to take a message from here and say, listen, okay, doc, give me a sleeping pill, let me just get knocked out, and even if I get knocked out for 6 hours, I'll have enough glymphatic flow to
Hmm.
that's not true. Again, nobody knows, but theoretically speaking, we know that none of the sleep aids that we use currently cause what we call as deep sleep or REM sleep. In fact, most of them deprive us of what we call as a real sleep. So natural sleep is the best. And how can we use a pharmaceutical agent in the future to replicate natural sleep? Who knows? Maybe coming down the pipeline. Uh, it's not there yet.
But something that could certainly be interesting. It makes you wonder that the complexity of sleep. Is it possible to replace it? Like perhaps you could have a pill that would help with lymphatic flow, but it wouldn't necessarily get all the other elements of sleep.
That's a great point, Like you're absolutely right. And so, it's a complicated process. It's not just one thing leading to another. And, what other players get left behind is what we don't know.
Right, exactly. Well, there's certainly going to be more for us to talk about. And when there is more research out there, we'd love to have you back again. But that is all the time we have for today. Thank you so much for joining us, Vivek.
Oh, no. Thanks again for having me. And I'll be delighted to come back again. Thanks again.
This is the GW Integrative Medicine podcast from the GW Office of Integrative Medicine and Health.
I'm Dr. Lee Frame.
And I'm Janet Rodriguez. Thanks for listening.
The Office of Integrative Medicine and Health produces the GW Integrative Medicine podcast with funds from your donations. Your generosity allows us to raise awareness of the benefits of integrating whole person care, including evidence-based complementary therapies, into healthcare broadly. Help us continue to grow the podcast by making a tax-deductible donation on our website, smhs.gwu.edu/OIMH. Click the Give Now button on the left. While you're there, sign up for our free monthly newsletter for even more evidence-based content, including free webinars.